Hi, my name is Miley Helgeson, and today I'm going to talk about some ways that I speak with patients about acupuncture for pain. If you're a patient, I hope this is valuable to your understanding of Chinese medicine, and if you're a practitioner, I hope that this provides a memorable tool for your practice. As acupuncturists, many of us are asked the question, how does acupuncture treat pain? Here's a short answer that I hope can help you talk to your patients in a way that's understandable. When we're talking about pain, usually we're talking about two major substances in the body. One is blood, which is easy to relate to. We bleed and we're able to see this. There's a visual and tactile connection to it, and sometimes even some of us have the unfortunate visceral reaction to it. The other substance is called qi. Now, qi you could look at like gas in the engine. This makes everything work in the body, and when one or more of these substances is not flowing right, often we have a pooling area of stagnation, and this is painful. An example from our own bodies to connect that works great is simply a bruise or a hematoma. One can easily see that blood has indeed stagnated under the surface of the skin, and when pressed, it's uncomfortable. Acupuncture, using fine needles inserted into the body, is able to assist in the movement of that stuck blood or qi. Think of a healthy river environment, a beautifully balanced ecosystem. Now imagine what would happen if a dam were to be built in that ecosystem. Historically, dams are incredibly damaging to the health of the plants and wildlife, both above and below the area that's been blocked. It can even lead to extinction of species in some cases. So similarly, our blood and qi flows along rivers throughout our body. Sometimes these rivers will get blocked, and the resulting qi or blood stagnation manifests as pain, just like the damaged health of an ecosystem. A particularly good example is a biomedical diagnosis of sciatica. A patient with sciatica often has a river that has been dammed up in the gluteal area. However, their aching pain is manifesting further downstream at the back or lateral part of the knee, or the outside of the thigh, or even the outer edge of their foot. These areas are all downriver from the dam site, and this damage is cascaded down, causing issues in other parts of the river. So with this example here, you have a useful way to explain why, number one, you might not be concentrating needles all at the site of pain, for example, all around the lateral knee, and why you might be treating their glute, or the other way around, why you might be, putting a lot more needles further downstream in their foot, for example, and maybe more needles are concentrated there than in the glute. So I hope that these two quick examples can help practitioners explain pain within the language of Chinese medicine and can help patients easily grasp the concept. Thank you for your time. Please post questions, and I will do my best to get back to you. Thank you.